Well, welcome everybody. This is our first session. We have a terrific speaker tonight. Yes, exactly. Yeah. So we start at the top and work our way from there. So I'm gonna introduce. I'm gonna turn this over to Professor McKean. But just want to be sure everybody had a. I just want to say thanks to everybody who did the emails. Just a reminder about how this program works. We'll have a structured conversation with our speaker for about half hour, 45 minutes. They'll then turn to the three students who did the briefing to lead the conversation. We'll turn it then to the remainder of the class, and then anybody who's not enrolled here, and I'm not sure who that is, but if you're not, then you can. Will be plenty of time for questions from the rest of the class. So, with that, Maeve, you want to do the introductions? So thank you.
So thank you so much. So really excited for our Spring 2020 Conversations in Global Health class, and to have my friend Keifer Buckingham come and talk to us about her current work and her career leading up to here. So she is as everyone knows, at the Open Society Foundations, and I realize I'm guessing your title because I always say that you're the Senior Advisor of Global Health.
Sure. Yeah.
But I actually realized I should actually ask you, what is your title, Kiefer?
I guess I can. Senior Policy Advisor for International Public Health.
Okay. Yes. So the Senior Policy Advisor for International Public Health. And we've known each other probably for over 10 years, back when we were both advocates at different nonprofits. And so I'm really excited because I think Kiefer, your career trajectory is very similar to what a lot of our students will have, working in nonprofits and advocacy, working on Capitol Hill, and then going into the foundation world from an advocacy work. So what we would love to do is just talk about, a little bit in chronological order of where you were at college, what you were thinking about, what you were studying, and how, sort of that first job out and what you learned there. So.
Totally. Great. Well, thanks so much for having me.
Yes.
I love Maeve. So of course I love you too. So I was more than happy to come chat. There were many people in my academic career and then early in my career who I depended on to learn things about, where should I go interview, and is this the right job, and is this the right title, and how do I get in, and do I have to go the policy route or kind of the implementer route, and is that a decision I have to make? Maeve was one of those people who I had many coffees with, and I'm like, what do I do? So and I tried to give back and do those informational coffees frequently. This is better because I don't have to have coffee with 20 people individually. I get all of you here, so that's nice. But I will give you my card also after, and you're more than welcome to email me or hound me or. So I went to undergrad at a really tiny private liberal arts school in Arkansas called Hendrix College. So I don't know. Most people east of the Mississippi haven't heard of it. I'm from Tennessee originally, so it was a little bit more my speed. But right, there you go. Okay, so it is a great school, and if people east of the Mississippi may have heard of like Center or Swanee or Rhodes, it's kind of like that. It's like very small. And there it's very crunchy. It's very, I don't know. I don't know what words people use these days. Back then we said hippie. Now we say hipster. Apparently it's different. I don't know. No, anyway. But I created my own major because why not? In international development, because there wasn't really a lot there. I knew I wanted to do something. At the time I was excited about agriculture and the impact that, we didn't call it climate change then, but we called it global warming, had on people's ability to. I know, and I keep looking at you. I'm sorry, I shouldn't do that. No, it's okay. It's okay. But yeah, I didn't. We had the whole Al Gore and global warming, and that was it at the time. So anyway, the impact that had on people's communities and livelihoods, and so that's what got me into quote unquote development. so I said to my professors, all right, I've got some econ, I'm doing some African history stuff, that's exciting. Can I just kind of do my own thing? And they were like, sure. So I focused.
It's not always an option of joining.
I know, yeah. But it's really cool because now, because of the work that I did and the curriculum that I came up with, it's now a official minor at Hendrix. So there were a lot of people who kind of came up after me and were like, I want to do that too. And there were more and more things. Hendrix was a great pre-med school, so that's kind of where the public health started to come in, where more and more folks who I was talking with were excited about the combination of the health curriculum that we had at Hendrix, but then taking it globally. And now there are tons of students at Hendrix that are going into global health. So, and I'm glad that I was kind of a small part of that. And so when I was in undergrad, I was not really into public health. I was more into like development. I don't know what that means, you know. I thought it was cool. I didn't really know what it meant at the time. But I went on a trip. I was fortunate enough my freshman year to go to Rwanda. Hendrix started a exchange program where we brought 4 Rwanda, like the best of the brightest of STEM students from Rwanda to go to full 4-year scholarships at Hendrix. And we made a commitment to President Kagame to do that for 8 years. So 8 times 4, you know, whatever that math is, that's how many students we had, which was really cool. But it was there that I actually visited a PEPFAR funded clinic. Did you know this? Yeah, in like rural Rwanda. And I was like, oh, I want to do that. You know, there was just sort of this moment where I was there for again, these students were STEM and it was about education. I was kind of like, well, whatever, I get a free trip to Rwanda. But being there and just sort of seeing the impact of U.S. investment very early in my academic career, I was like, okay, this is what I'm going to focus on. So, and then if you had asked me my sophomore year of college if I was going to go to grad school, I probably would have said, no, Peace Corps. Or other things. Yeah, I know. or other things. But I ended up actually going straight to grad school because I got into a great program at GW. Their master's.
Why MPH? A Master's of Public Health.
Yeah, and that was, I was like, I probably should go to grad school, right? Like maybe I'll make more money. I mean, I wasn't sure, but I was looking around at programs and I found one, and this was this GW Master's in Public Health, because I was like, do I do an MS? Do I do an MS? There were so many different options to do. But this program specifically was the thing that drew me to the MPH. And it was a program where it was 2-year masters with 6 months, grown-up study abroad. We did 6 months intensive in Kenya, where we went to school at a local university in Kisumu and did real projects that were affecting the community, which is around Lake Victoria, which has the highest malaria rates in that part of sub-Saharan Africa, but definitely in Kenya because of the lake, right? Water, mosquitoes, right? And various other compounding, very interesting factors. And I was like, well, I'll do that. So, I mean, it really wasn't like I decided that I was going to go get my MPH. It was like this program sort of showed up, and as I was kind of researching one day, and I was like, I'll apply, and if I get it, great. If not, maybe I'll go work somewhere. And yeah, it just kind of happened, and I knew I wanted to be a little bit more on the policy side, which was why the debate about MPH versus public policy or some other graduate program was a little bit difficult.
And what about going there made you, when you were doing that debate between being a policy versus an implementer, do you have any memories of, because I think going and seeing a PEPFAR program in the field makes you want to be an implementer because you want to be the one who makes that happen. So I think it's interesting that when you went overseas, you had what might be the opposite reaction of what others.
So when I came back from that trip in Rwanda in undergrad, I sort of was like, okay, this is what I want to do. But when I eventually started, I took a really amazing HIV policy class also my freshman year. And all of these things started to come together about the establishment of the Global Fund, the establishment of PEPFAR, what the politics were at the time, the Bush administration, the politics of HIV in the United States and what that meant to a debate about making this giant investment globally. And then the paper that I ended up doing for undergrad was about the impact of US laws on contraceptive access globally. So I sort of was like, I'm not really good at science. I'm not really good at math. So being like in the field would be nice, but like not something I felt like I had the skills to do. I was like, I'm a public policy person. I'm wonky like that. And it just sort of made more sense. Like, this is how I can get into it.
I feel you, like many people in global health, somehow started in the HIV world.
Yeah.
And you'll see this if you look at anyone's resume. At some point in time, they have PEPFAR on it,
Usually.
more or less.
Yeah. In the policy space, yeah. Yeah.
But then you transitioned from that into a reproductive health advocacy. And
Yeah.
so can you talk about I actually don't know what you did at IPAS because that was before my time with you.
Right, that's true.
So can you explain what IPAS is to everyone and what you did there and how that transitioned to advocates?
Yeah. So that transition started when I was in grad school, because when we started doing this program, I did my MPH in global health policy, right? I didn't get more specific than that. It's not like I was like HIV policy or reproductive health policy or whatever. But I was interested in reproductive rights domestically, and there were more and more kind of questions that I had about, like, well, what are the impacts and how are we, how is the U.S. policy on reproductive health as an implementer or as a provider of key services, how does that impact people's lives on the ground? And it started out like, light, like women and girls, like, gender-based violence, and, that has to do with HIV for sure, right? And then it just sort of, I learned more about the Global Gag Rule, and or the Mexico City policy, or the Protecting Life and Global Health Assistance policy, depending on who you are and what decade it is, and, what your political affiliation is, and various other things. That was the thing. It was like, okay, how are we really going to accomplish these goals that are laid out politically, a piece of legislation that says that we want to do XYZ on HIV. How do we, from a public health perspective, social and economic determinants of health, right? Y'all learned that day one, right? It didn't really line up for me that we have all these goals on HIV, but at the same time, these same women who are, at risk also, have trouble planning their pregnancies because they don't have access to care, or, people's lives don't happen in a silo, right? Women don't necessarily want to go to one clinic for HIV and one to go get their bed net and one to, and so that was the thing that started to bring me in. I was like, how do we really think that we can accomplish all these goals with this policy, which now is even more impactful on HIV programs, but that, really kind of brought me into the reproductive health space. And to your point, everybody's working on HIV. Now there's more and more people working on reproductive policy. But yeah.
So what do you think those skills, what did you learn those skills of working at an advocacy organization?
Yeah. So I think one of the first things I did before I was at IPAS, I was at the Public Health Institute, and my boss started sending me to coalition meetings. You'll find, yeah, the Public Health Institute is based in the Bay Area of California, so it does a lot of great domestic health work, good, basic, awesome public health stuff like working to eliminate food deserts and provide access to healthy fruits and vegetables in communities that are more at risk for diabetes and obesity. They also do great work on smoking cessation and stuff like that. But they had a pretty large portfolio on women and girls, on providing. They also had a really huge contract from USAID at the time that was providing critical staffing for country teams, program teams. So anyway, all that's to say, Public Health Institute is one of those advocacy organizations in DC that was sort of fighting for funding on the Hill for global health programs, like maternal and child health programs, things like that. And they would send me to these coalition meetings, and you'll find in DC on policy stuff especially, it's not like one group or one person. Everything has to be done in coalitions. So we sit around rooms like this and have very long meetings, which Maeve is familiar with, where we discuss strategy and then we move forward. And of course, I'm like, at the time I was an intern and I was just excited because I got to see all these people like Maeve, who have been doing this work and who are advocates. And I was taking notes furiously. And so that was an interesting shift because I had gone from policy analysis to policy and practice, right? Like I'd written my paper, for grad school. I had written my paper for undergrad. I thought I knew all this stuff about policy. But when I got to an advocacy organization, you learn a little bit more about politics, right? And for global health advocacy, it's both. It has to be both. It's little p politics and big P politics. And that was super exciting to me.
So I think that's actually, I was just having a conversation with someone yesterday who said, he was talking about how there are people who say, I'm really interested in policy work, but I don't want to do politics.
Yeah.
I'm not political. That's not what I'm interested in. And it was such a funny thing to me because you can't do policy if you're not interested in politics. Because policy without the ability to actually implement it, which means working with people and working with coalitions and building those, nothing's going to get done.
Right.
And so, but you clearly appreciated that from,
I love both.
Yeah, you love both. And then you ended up going to where one of the most political places you can go, which is a job on Capitol Hill. But that really, and not everybody, again, not everyone likes that world where you are, I think it'd be really fun to work for Barbara Lee. I never have, but can you talk about sort of what you saw as the skills that you need to be successful in that highly political realm? Because for me, you were sort of advocating from a place of higher power than when you were.
For sure, or just different, right? I mean, a different place because. I think especially working on the Hill, the biggest need, and it's similar to the one outside, is relationship building. Really, y'all, you can teach anyone, like, the ins and outs of a certain policy or whatever, but DC especially, if you plan to work here, whether in advocacy or in grant making or whatever that is, so much of what we do is about relationships and trust, and that's how PEPFAR got done, frankly, right? In a tumultuous political time, think about it, right after 9/11, the country was at war. Think about the context at which PEPFAR was passed. There was a lot going on, and people were kind of desperate for something that they could work together on. And we talk about that now as like this watershed moment, but it was hard at the time. There were nasty political fights that happened. We've kind of forgotten all those now, but that's the reality. And so thinking about, and that happened because people built those relationships with one another. And to me, that was the most exciting part about being on the Hill. When I worked for the Congresswoman, I was thrown into a portfolio. Of course, I got to work on global health, which was great, but I also had 20 other things that I had to work on. Like, I was the immigration staffer. I was during the Muslim ban and like various other things. I was like, I can't be the immigration, like, you're deporting people? What? I couldn't be the immigration staffer, but I figured it out because, those basic skills I thought that I brought and that I felt like you needed was honesty, trust, being able to be very flexible in the moment. And those are not things that you learn in school. I really think those are things that you learn working together on group projects and things like that, frankly. Those were the skills that I think work here in DC, and you know that.
And what about just, sort of working together, and PEPFAR came together because of coalitions of non-like-minded people.
Yeah.
So you are clearly a very fierce advocate on the things that you believe in, but how do you work with people that I'm thinking, the Muslim ban or other issues that you just disagree with?
Yeah. I mean, it's really hard. I mean, and especially on the Hill when we had things like that would happen. And I had an interesting time because I was there during the last year of the previous administration and then the beginning of this administration. And not when Democrats, and I worked for a Democrat, but not when Democrats were in the majority. And so we were on the defense. So we're offense, defense. And that was really interesting because what that changes is sort of, okay, the people who you were just talking crap about, you now have to figure out how to work together with. And so the importance of maintaining those relationships despite like whatever is happening out here was really important. And so a good example of what we did is a couple of years ago, there was really bad famines that were happening across various parts of the world. So Yemen, there was sort of issues at the port of Haideh, which was bringing in a lot of food. We had issues in South Sudan. And so a bunch of, I sort of went to a couple of my Republican colleagues and said, look, y'all, I know that your bosses care about this. Some of them have big like agriculture states and things like that. So you're like, I know you care about this. Let's ask, the speaker and the majority, let's ask the majority for additional money to fight these 4 famines. And me and a couple Republican staffers and a couple outside activists and a couple Democratic staffers came together and wrote this paper, this like essentially a memo to our bosses that said, I think we can ask for this money. And it happened like overnight. They were like, yeah, you're right. This is horrible. But those people that I built those relationships with, I ended up going to frequently for things. And sometimes it would be like, hey, I hear you guys are planning an amendment in committee tomorrow. Can you give me a heads up on that? Because I do not want to write that speech for my boss, or something like that, where I needed those relationships with, in my case, it was Republicans or even a Democratic staffer who I didn't agree with on things, being able to still, disagree with each other on 95%, but then finding that 5%. And unfortunately, I think that is hard to find sometimes. And that's why, again, the relationship building, the honesty, the trust stuff is so important because they also knew they could come to me. And I worked for Barbara Lee. She's not exactly like, she's a little bit of a Democrat, a liberal sort of, outspoken, really powerful Democratic member who's been there for a really long time. A lot of Republicans don't like her. But I knew a staffer could come to me and be like, hey, can we work together on this? Even though it's Barbara Lee. So yeah, I mean, we found ways to do it. And
because I was going to ask you I always tell students, you're in Washington, D.C., if you have the opportunity interning on the Hill, even it's for a semester, the skills you learn are extremely important. Like something we talked about, relationship building and how things get done. And also, I think for those who haven't worked on the Hill before, it's this black box where no one actually understands what people do all day. So I think you sort of described very well what some of the things you do, which is talking to people about what you want to get done. But if someone said, well, what exactly did your job entail other than having 20 different topics you had to you had to work on?
It was a lot of meetings. I would say during recess, I mainly met with constituents. So I usually scheduled all my constituent meetings, groups that were coming in. So I was the health staffer, the LGBT staffer, the abortion staffer, the immigration staffer, the global health staffer, the foreign policy staffer, and the appropriations staffer. So if anyone wanted to talk to the congresswoman and bring their concerns about those issues, I was their go-to person. And of course, that's our job. That's our number one job, right? Is to serve the people of the Bay Area, the East Bay. So that's Oakland, Berkeley. Okay. So that's UC Berkeley. That's Cliff Bars. That's, Ghirardelli Chocolate. That's the Public Health Institute is a constituent of the Congresswoman Lee's. So yeah, I mean, that was my job. But I usually try to schedule those during recess. So that's when the members are out of town. So I could spend a little bit more time with those people, making sure that their concerns were heard. When we were in session, it was meetings with other staffers, calls with other staffers, staffing the Congresswoman. So I wrote, 20 to 30 speeches a month. A lot of them didn't get read. Let me tell you, that is like hard when you spend a lot of time on a speech and she gets up and she's like, I want to talk to you about something. And she just puts, and she just doesn't use that. I really want someone to do a great memoir where they pull together, or like a collection of speeches that never got given. The speeches that never got delivered, or the speeches that like you really wish your boss had delivered because, yeah, yeah.
So one of the projects we have for the students is to write a 2-page memo to their boss.
Oh, nice. Yeah.
How many 2-page memos do you think you wrote?
Oh, never 2 pages, always like a page. The clear and concise thing was also really difficult because these members, as much as I had 20 issues, she had 100, right? I mean, she had various different committee assignments, and for someone who was so senior, everybody wants her for everything. So being able to put a memo that was clear and said, okay, here's your top line. If you want more, I'll give you more. But I knew that there was like something bolded and then like 2 bullets. And especially if I was asking her to do something, that had to be like the first line. Because otherwise it's just, we sent her home with homework every day. So bless her heart, she had this big folder and she would get it and she'd have to take it home, and she had homework. I mean, because she's worked all day. Her day started at 7. Her day maybe ended at 8 or 9 when votes are over. And then she has memos to read. And she has speeches to edit. And so our job was really to also make her life a little bit easier because she is also such an activist herself. And so she wanted to be everything for everyone. And every once in a while, our job was to say, sorry, you can't. You need to eat food, please. Please drink some water. Take a break, and you can let this one go. But she was like, no, we have to do this. We have to fight, and it's great. It's a great problem to have. But sometimes that was the job too, was to be able to, a tough job was to be able to say, you know what, let's give this to someone else, or maybe we gotta, and so the staffing up, the managing up, which people talk about sometimes is, as a manager, you think about how you manage all the people below you, but as staffers, a lot of what we were doing was just looking out for her too. And Congresswoman, have you eaten since breakfast? You haven't, okay. Let me go get you a sandwich. Sure. Yep. No mustard. Great. Yeah. So there are like less glamorous parts about it, but it's all about, taking care of this person who you want to be all the things for all the people. But yeah, tons of memos, tons of speeches, late night text messages, phone calls. Then when she was in California, that was 3 hours behind, right? So I would usually work till much later because she was awake and ready to go, and I was trying to go to bed. She's like, all right, what are we doing? Okay, sure. So yeah, I mean, there's every member has their quirk, and just like anybody, even if you're not working on the Hill, every boss has their quirk, as you know. But I think that again, all goes back again to that kind of trust thing, and being able to prove, especially with memos, the one thing that Barbara always wanted to know is, do you know the answer? And if you don't know the answer, you better say so. Because that was the other thing, is like if you write a memo and it's kind of wishy-washy, like if you're not being like, here's your number 1 point, you're going to sign on to this bill because of this. If you don't sign on, here's the possible ramification. Here's the pro and con for sure, but you need to sign on to this bill. If she asked me a question in committee and she'd lean over and she'd go, Kiefer, how much money is this thing and what do we do? If I wasn't immediately like, it's this, blah, 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 here's your answer, you vote yes. If I sort of said, well, she'd go, nope, and like ask someone else and just be like, So the confidence also of being able to say, back up your points and say why you're pushing for A or B, but also to be like, you know what, Congresswoman, I don't know, but I'm going to get you an answer right now. That was the appropriate answer, not like, well. So that's another thing too, like especially if you're going to be at all in the policy side, this, but.
Oh, that is really great advice,
Yeah.
and so true. And that moment of, you know what?
Yeah, it was just terrifying.
So, and I do want to make sure students have time to talk to you as well, but I just want to, this transition you then went sort of, again, from the advocacy to Capitol Hill to a very senior member to the Open Society Foundations, which is, it's the Open Society Foundations and a job that didn't exist before.
Yeah.
In the, so you're the first person to have this position, and you have it during an administration, which, as you talked about, is very different from the last administration. So can you talk about sort of what in your life made you make that transition?
Right.
And then how different the job is. This is a big, huge three-part question, but I'm going to throw it all at you, which is how different is this job given the current dynamics of the U.S. government? And then just talk about sort of what you're working on and what you're hopeful for.
Okay.
I know.
Yeah.
Four-part question.
Just explain what the Open Society Foundation.
Oh, excuse me.
Yeah, that's a great question. I will try to. He asked, explain what the Open Society Foundations are. I will try. We are giant. We are called the Open Society Foundations because we have various entities all around the world. In Ukraine, we're called the International Renaissance Foundation, and in, East Africa, we're called OSEA, and in South Africa, we're called OSEWA, and so we have all these different names. But I work for Open Society US, which is also a new entity, which is exactly what it sounds. We work on US stuff. Open Society is a big philanthropy, which our founder, George Soros, calls a political philanthropy. So we do not do political work, but our work is in a way political because, to Maeve's point, policy is political. Whether you like it or not, it is. And a lot of what we do are things that people, especially governments that like to suppress free speech, like to prevent civil society from organizing and showing themselves up, it's real political, right? The things that we do, the things that we fund. And so but to go back to your original question, there are two answers to the first one, which is like, how did I transition, or maybe like, why did I leave? So one was I wanted to start a family. And so I want to be very clear that that's important, being able to balance both your career and being very true to yourself and being okay to say, I need to make more money. And that being an okay answer, right? I deserve more. I deserve more time off. I deserve more money in my pocket. I deserve a good family leave policy. And as you all know, on the Hill, and just until recently, federal employees had no paid family leave. Now we have 12 weeks. But that was the reality that I was in. And I said, I can't do this in this current environment. I love the Congresswoman, but I need to find something different. So that was like one very important part of it. And I'm not shy to talk about that. But the other part of it was I was burnt out. I was so tired. And I actually left the August before the election where Democrats would have been are now in the majority. And a lot of people were like, you're leaving in August? What if we win? And then we'll be legislating. And I'm like, and then it's even more work. I mean, I happen to work for someone who was like to describe herself as the resistance. So we did more work than anyone anyway at the time, in the minority. But, then you're in the majority, then you have to really do stuff, right? Then you need to legislate. And it wasn't that I was scared of that. I was just like, well, what if we don't win? And so for me, it wasn't an important calculation. The calculation for me was find a job where I can continue to love what I do and also get paid what I'm due. And I found that at Open Society that has a lot of, their values, both externally and what we fund, are reflected internally. So I'm really lucky to work for a place that cares for me and my family, and so that was important. From a sort of values and a content space, it's my dream job. It was one of those situations where Maeve and I talked about it. It was one of those situations where the job description came out and people are like, Kiefer, it's your resume? This is your job, right? Did someone write this for you? So when that happens, the universe is like, hello, warning, take this job, apply for this job, spend more time on this resume than you have on any others.
And just for the job, the job description was need somebody who.
Yeah, I think it was like, to do like international, like global health policy, including reproductive health, like global gag rule, PEPFAR. It was like all these key words, and I was like, yes, 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 yes. So yeah, I feel so lucky. I mean, that's the thing. It was like we're meant to be together. So that transition was hard though because it's a philanthropy. I was like, I've never given out money. I don't know how to do this. Luckily, I don't have a lot of money to give out. Because I mainly do policy advocacy stuff, although I have been able to do some grant making, which is really exciting. And it's a political philanthropy. So we sort of say, what are the things that would be most impactful in terms of an investment? So those relate to things like global health policy, like one that I funded this year, and this is all public, it's okay, that I'm really excited about that is completely nonpartisan/bipartisan is this effort to get the presidential candidates to all talking about ending the global pandemics of AIDS, TB, malaria by 2030. So we sort of said, here's some principles and here's a platform. We would like each of the presidential candidates to take these things and make it their own. And like maybe if you mention it in a debate, that'd be awesome. And so that's been really cool. And so there's, people in Iowa bird dogging Buttigieg, and there's people, tweeting during a debate, and we helped fund that. And that is important because that we do think that the next president or the next administration, whether it's the current one or a new one, should make those commitments because that's an important historical U.S. moral leadership thing, right? So that's really cool.
Because there's so many negative things, I asked you something you're hopeful about, but that actually was a very positive thing that you did talk about something that you are hopeful about, that increasing the advocacy and the engagement. Yeah, I mean, under this administration has been difficult because I do work on reproductive health and rights, which has been something that this administration, has, in my opinion, undermined dramatically. And so for us, it is about making sure that civil society folks that want to A, hold an administration accountable, or B, maybe provide another administration with a blueprint for what they could do that's better or whatever that is, making sure that civil society, and this is what OSF does around the world, is well equipped to do that folks have the resources to, lobby their members of Congress or have the resources to meet with PEPFAR and USAID about how they're distributing money. I mean, whatever it is. And so that is the kind of exciting part about what I do. I get to both go on the Hill, do my own advocacy, and then also make sure that my colleagues and friends that I work with are well equipped to do the same thing, because many voices is better than, a couple, right? So yeah. And then John, do you have any last questions before I turn it over to our class? It's so exciting. Good. So I'm going to turn it over. What we did, we have 3 students who are going to start off asking some questions, and then we're going to open it up to the rest of the room. So if you can,
should we pass the mics, or
we're going to pass the mics, and if you could, please.
I realized I forgot to ask everyone to introduce themselves at the beginning.
Okay.
How do you want to wait until we go? Just have people introduce themselves.
I was going to. Yeah, so you can just for the video. So if you could please remind us your name and what program you're in, that would be wonderful. Okay.
Hi, I'm Shwait. I'm a sophomore in the STIA program in the SFS, and STIA is just Science, Technology, and International Affairs.
Oh, cool. And SFS is the school.
Yeah, sorry,
Yep.
a lot of
Yep.
acronyms.
I knew that one at least.
So something I was kind of interested in was this kind of the idea of reproductive health rights. Over the summer, I did a little bit of research on like refugee camps, and there was a lot of talk about reproductive health and rights there. But
sure.
that idea was kind of different from the reproductive health rights, which I kind of got from what you were saying about like domestic policies in the U.S. Over there, it was about making sure that women had access to prenatal care and postnatal care.
Yep.
Whereas it seems like the conversation here is more on allowing women to have access to abortions and
Right.
things like that. So I was just, I think in the first place, it's really good that we have a discussion of reproductive health rights here in the U.S. because I think at least like my impression was like, oh, like we're fine here in the U.S. Let's look internationally. But it's like, it's kind of awakening to see like, oh, like we still have problems here that need to be addressed. But I guess my question is there a global definition of what reproductive health rights is? Yeah.
Okay, I got you. Are you doing all of them or just one at a time?
We can do one at a time.
Yeah. Okay, cool. So first of all, there is an official definition. A couple of years ago, the Lancet Commission had a really great paper that our friends at the Guttmacher Institute, which is a research organization, and they actually came up with what is considered the globally recognized definition of sexual and reproductive health and rights. So that's kind of, we say them all together. So SRHR, sexual and reproductive health and rights. And what's interesting is you can really break each of those things down. Sexual health, sexual rights. Reproductive health, reproductive rights. So reproductive health, everything from access to me. Now, I think if you ask different people, beyond that technical definition, you ask different people about what services are included in that. To me, reproductive health is everything from access to menstrual pads for girls in schools to, access to condoms and information for young people to, and then you can just keep going, right? And same with like sexual health and sexual rights. That's everything from sexual orientation and gender identity all the way to being able to have a child if you want, and that the right to that, which we don't talk about enough, like access to fertility treatment, and then the ability not to have a child if you don't want to, right? So all of these things, and then there's a whole nother, conversation about the right to pleasure, and so there's a lot packed in there. I think when we talk about reproductive rights in the U.S., you're right, it often goes to abortion rights because there's an assumption that like we've done everything else, so this is the last frontier, but that's also a false assumption. Reproductive rights in the U.S. is also about racial and economic equity. It's about the fact that women of color have a maternal mortality rate beyond like times and times and times that of white women, that trans people have lack of access to reproductive health care. And so, again, there's like assumptions, right, about like what's there. In refugee camps, and if we talk about a good example of sort of the impact of U.S. policy, we under this administration defunded UNFPA, which is the United Nations Population Fund. But in this is a great example. Refugee camp in Jordan that the U.S. government has funded for many years, and there's actually like little bassinets at this camp that have like U.S. flag on them that say "From the American People" that had to be like scratched off. After we stopped funding them, they, with the help of U.S. money and other multilateral donors, had not one child death in an entire year because of the access to services in the most dire of circumstances, right? So then that's reproductive health and the right to not die in childbirth. So anyway, there's a lot to unpack there, but I think it's a discussion that hopefully we're expanding here in the US, that it's not just about abortion rights, and it definitely is about abortion rights, and then about all the other things. And so it's a great question, and one that I'm super passionate about, and that a lot of other people are passionate about. But from the global health perspective, check out that Guttmacher definition, because I think it's the one that most people like really attach to.
No, I think also that is such a great understanding of how sexual reproductive health touches all of us, even if it's not the thing that drives us in our passion in global health. It is so much a part of the global health world. So turning to our next student.
Hi, I'm Maya. I'm a junior in the Nursing and Health Studies School studying global health. I'm very interested in policy, so it was really awesome to hear you talk
Great.
about that. Over the summer, I worked a little bit on bringing, again, the global gag rule to some Congress people, and also some senators. I met with the office of Senator Kamala Harris.
Great.
And I was wondering if you've seen any progress on that. So I know that, I talked to them, it happened, but, what is going on now? What is the conversation? What does it look like now?
Yeah, so I'm happy to also have a separate conversation about this. So the Global Gag Rule, aka the Mexico City policy, aka the Protecting Life and Global Health Assistance policy, is dramatically expanded under this administration, and that was something that I think a lot of activists actually weren't expecting. So that has been really interesting as well, right? Because the traditional, I'm sure you learn about this.
We Might want to do
I'll do a quick primer.
the 90-second.
Yep, the 90-second.
Yes.
And I'm sorry to always interrupt.
No, please.
Sometimes good. No, it's great. Just if you could do the
Yeah,
90 seconds.
got it.
Yes.
Got it.
A little bit of the history. How we
Yeah, very quickly.
That we have lived this and then
Eat, sleep, and breathe it. Yeah, no, very quickly. So the Mexico City policy was established under the Reagan administration. The goal is to prevent, or it prevents U.S. funding, people who receive U.S. funding from using their own funds to do any abortion services or to even talk about this. So it's Gag, right? Gag Rule. Okay, so that's like kind of the way to remember it. And it is not statute. It is something that gets established by presidential memorandum or executive order, right? So what happens is, Reagan put it in place, and then Clinton rescinded it, and then Bush put it in place, and then Obama rescinded it, and then we just thought the same old thing would happen, right? And Trump, and it literally happens on day one. I mean, that's how big P political this is like you could do so many things on day one, on your first day of office, and this is the one that you choose to sign the piece of paper. Obama with his left hand, right, on day one, of his administration, undoing the Mexico City policy. It was great. And then Trump, day one, right, with his, so yeah, his, marker giant, like this thing, right? That's his signature. So, but this administration dramatically expanded it. So traditionally, this funding has only applied to family planning and reproductive health funding. And to be clear, we say only, but the U.S. has historically been, and actually still remains, the leading bilateral donor in that space. So like if you're going to a clinic, like in many countries where the U.S. works, it's very likely that U.S. money helped fund that. And so
it's family planning and reproductive health money out of our USAID.
Yes.
So
Yeah.
our development agency.
Yeah,
That is
exactly.
the last 20 years of this.
So bilateral meaning just the U.S., right? Whereas multilateral meaning putting a lot of countries' money into a pot of an agency like UNAIDS, right? Or UNFPA. And so, but this administration decided to expand that to all of global health assistance, which includes PEPFAR. So that is a huge multi-billion-dollar program. And so that's the global gag rule, AKA all the other things. Right now, so we had some great early wins when the Democrats took back over the House. There was it was in the middle of a budget thing, and Speaker Pelosi put in repeal of the global gag rule in that budget document. And I am personally of the mind that budgets are moral documents. And so even when a budget doesn't get passed, it's important from a policy perspective to say what we care about in those budgets and principled way, which is just like the president's budget, which will come out in 2 weeks. It means nothing. The president's budget means nothing, except that it's a moral document, except that it's you put your money where your mouth is, right? And so therefore, if you're putting out a budget that says, I want to remove all funding for XYZ, morally, you are telling us your principles. You're putting it all out there. And so Democrats have included repeal of the global gag rule in all of their budgets, which has been great. We have a bill, there's a standalone bill called the Global Her Act, which you probably talked about when you were on the Hill. And I am not lobbying, I'm just saying that this is a thing that exists. And it has like 90% of the Democratic caucus on it. Unfortunately, it's not bipartisan. This used to be super bipartisan. Actually, there were several Republicans who, even when the expansion first came out, they were like, wait, what? We thought you guys were just doing the family planning and reproductive health money. Really? All of PEPFAR too? And there were several Republicans who quietly were like, oh no, we're not okay with that, because global health funding is very bipartisan. We have had, or at least it used to be, tremendous amount of, and not even bipartisan, but nonpartisan. Like, this is not something that we talk about, Republicans and Democrats. This is just like what we do. So right now, that bill has not moved in that it has not been marked up in committee, which is the House Foreign Affairs Committee. But there's a lot of pressure to make that happen right now before the end of this Congress, because what happens, Congress has 2 sessions. We're in the second session. So next January, when we start back, it will be a new Congress, the 19th Congress. And then you have to reintroduce the bill, and you have to get more people to sign on, and the process starts all over. So there was some movement in the Senate side. Senator Shaheen is a big fan of repealing the global gag rule, but it lost, despite having bipartisan support from Senators Collins and Murkowski. So the answer is not so much. But what's happening also is behind the scenes, and it's why important, why folks like advocates, researchers, what they're doing is trying to understand the impact. And we had known for many years the impact when it had to do with just family planning and reproductive health, but we've had to obviously dramatically expand our scope of knowledge. And for those of you who are interested in kind of the monitoring and evaluation, research side of global health, a lot of that is happening right now. Folks at AMFAR, Foundation for AIDS Research, Guttmacher, various other research-oriented folks are working hard to understand and to bring that information to legislators and say, look, you really are impacting, for example, PEPFAR that enjoys broad bipartisan support, and maybe you're not going to reach your targets for HIV testing or treatment because the people who could be providing those services and are maybe most trusted in the community or best positioned to provide those services can't get the money or won't sign. So anyway, that's another way to think about it, is the research is happening. And so politically, unfortunately, there's not a lot of movement, but more and more people are trying to at least communicate what we're losing,
Say just a word about. Sorry, could you say just a word about how funders support organizations that analyze the data, like you just described, to show the impact? Because it's the current administration, for example, because they support this. This isn't a primary focus of their own oversight. So maybe you could, because that's a critical way in which funders and advocates work together to bring information to the policy process.
Yeah, that's a great point. I'll be really brief because I know there's someone else. But we have, for example, funded a lot of organizations to do this research, to literally go in country and do both quantitative and qualitative research, focus groups, talk. And people are fearful to talk, by the way. That's the other thing. People are scared that if they do receive U.S. money, they're scared that they'll lose it if they talk to someone. So it's also about, good research practices and, informed consent and all this stuff. Security of people's information and things like that. But the administration was technically supposed to be providing reviews of the policy every 6 months. They did that once after a year, and it was woefully inadequate, partly because it had only been 6 months. I mean, they did it for 6 months, but it wasn't released for a year. So we also couldn't prove impact after 6 months. It was so, you know what I mean? It hadn't been enough time. And so they put out this paper that was like, see, nothing's happening. And we were like, no, that's not, we were also as advocates. And then at the time I was on the Hill. So from an oversight perspective and from a member of Congress who is an appropriator, which means that she writes the checks, right, for PEPFAR, she was able to be like, no. In theory, members of Congress, from an oversight perspective, should be able to be like, we're not going to give you your money unless you clean up your act. Or, in theory, that's what should happen. It doesn't usually happen. But members of Congress can now depend on organizations that OSF and others fund to say, okay, well, if the government isn't going to do the right research and monitoring and evaluation of how this policy is impacting, then we will do it for you. And then we will show you, we will hold the government accountable. And so that is a core value of OSF, principles and how we do our funding. So that's a great point. And it's been really critical. And like I said, AMFAR has put out some really amazing data on the impact of global gag rule on PEPFAR funding. And that has, including my boss, she was real mad. Because PEPFAR is her baby. So she was like, oh no. So
Incredible role of data for advocacy. So if you're interested in data, get more interested in it, disaggregate it, put it into incredible data visualization
Right.
so that those of us who are not data geeks can understand what
Like
you're
me.
talking about.
Yeah.
And then use that in order to achieve what the goal.
Pretty graphs, very important. Yeah.
But it's an extremely important, especially as there is more data and there's more available.
Yeah, for sure. Yeah.
Hi, I'm Rachel. I'm a senior in the NHS, also a global health major. I was wondering, with the global push towards UHC for everyone, what are some of the ways that aid-dependent nations can provide adequate reproductive health in the current Trump era?
Oh my God, that's such a loaded question. That's great. No, it's a great question. So universal health coverage is like a big deal right now. I mean, there's been all of these, UN meetings, and I think a lot of folks, bilateral donors, aside from the U.S., are grappling with this right now. For example, the Global Fund is a really great place to think about this. So the Global Fund for AIDS, TB, and Malaria, multilateral, huge program. Everybody puts their money in the pot, and the great thing about it is you don't get to earmark where your money goes. It's just, and then the Global Fund board decides where the money goes, AIDS, TB, and Malaria, blah, blah, blah. But increasingly, the discussions at a lot of those board meetings have been, this isn't specifically on repro, but just generally about how do we set countries up to meet the need of UHC, and that's where a lot of people are going. So you hear a lot of nations who say, yes, we of course need to continue to fund AIDS, TB, and malaria because these three programs or these three diseases are still, highly burdensome in a lot of countries. But how do we make the health systems fit for purpose? Where, to my earlier point about siloing, you can't. It's not sufficient to sort of just give someone a bed net and then also not talk to them about nutrition and access to family planning and all these other things, because that's what people want. That's what we're hearing, right? Is that people want it efficiently, they want it close to their community, and that's what UHC is about too, about everyone getting access to the care that they need, including reproductive health care. In a people-centered way, or at least I think that's what UHC is about. I think UHC is also one of those things where you could ask like 10 different people and they would give you 10 different answers. But like the Germans, for example, the Japanese, a lot of those countries are starting to think about their aid differently. Do we do more health system strengthening? At the Global Fund, they call it strengthening systems for health, but whatever. I don't know why that needs to be so different. But in the US, that often is a dirty word. If you talk to Republicans, you're like, yeah, we're going to do health system strengthening. They're like, that sounds hard. That sounds like we can't count all of the shots that you're giving. That sounds like we can't measure all the babies that have been, And so from a U.S. political perspective, our system, in terms of how we write the checks, the appropriations process, is not set up to think about breaking down silos. It's not. Because for us, if we think about accountability for taxpayer money, we're like, the taxpayers want results. They want to know how many babies we've saved and how many, mamas we've saved and how many pills, how many bed nets. And so the hard part is shifting the way that people think about health. For me, as a human rights person as well, it's about the right to health, and it's about the right, which is a fundamental human right. Some people don't think it is. But how do you provide services in a way that is the framing, not like the lack of disease, but the actual, and we can get all theoretical about that. But in terms of reproductive health care, it's even more difficult because a lot of people would like to say universal health care is all the things except abortion or all the things except reproductive health care. And it's like, you don't get to pick and choose. It's not like an a la carte menu that different governments get to say, well, we're providing UHC, except we don't provide people with food aid, or we're doing UHC except we, don't have speed limits on our roads, and so from a public health perspective, it is hard, and everyone is grappling with it, and advocates have a certain, sort of thing that they're pushing on, and then governments, are struggling with, well, do we turn the Global Fund into this mechanism for UHC, and then other people say, no, not necessarily. But if you continue to only fund in silos AIDS, TB, malaria, then we will not accomplish our goals. Because, for example, in DRC, we now have women who are getting HIV tested, they test positive, they're immediately on ARVs, they are serosuppressed, and they're dying of cervical cancer, right? Because we don't have cervical cancer screening, which can be actually very cheap. But then if you do screen positively for cervical cancer, we don't have access to services. So that is the struggle that people are bringing up, and that's a perfect example of kind of repro, where we need to strengthen systems. I don't have an answer for you. I'm just sort of waxing poetic about why this is hard. But I don't know, Maeve, you may have better insights.
No, I think that, no, the only insight is UHC is, it's everything.
Yeah.
And so it becomes, it becomes sort of in some ways too aspirational. That being said, when PEPFAR was created, the President's Emergency Plan for AIDS Relief, in many ways addressing HIV, which was killing 10,000 people a day, was aspirational, and we did it.
Yep.
And now we're at a place where it's a chronic disease, and and now we have other challenges. But currently now in 2020, UHC is so aspirational that it can mean whatever it means to anyone. And I do think that's a challenge because, here in Washington, D.C., we don't have universal health coverage.
Right.
So we haven't achieved it in our nation's capital. How are we going to achieve it in?
Yeah. Yeah. I'm sorry. That just gives you more questions probably. But this is a great question for you to have. And I'm like really excited that you're thinking about it and tackling it, because a lot of people are. So, yeah.
And we have time for a few more questions from the rest, if anyone.
Please, just to identify yourself.
Hi, I'm Hannah. I'm a neurobiology major and a STEM minor, and I'm actually taking a seminar through the Kennedy Institute right now called Current Topics.
Excuse me, Kennedy Institute for Bioethics?
Yeah. I'm
okay.
taking a seminar on current topics in bioethics, and something that we were actually talking about earlier today was the idea of reproductive health and reproductive rights, and how in societies where there isn't a history of having very open reproductive rights, in cases where there is moral justified reason for switching to a more open policy on reproductive rights, they may have a hard time doing so. And sort of the idea that in those cases, what obligation is there to then sort of fill that gap in providing support for vulnerable mothers who can't receive these services through support systems, like post-birth and things like that. So I was wondering what experiences you have, or what roles you see, like international governments or philanthropic organizations playing in the meantime, while we make this transition towards more open reproductive health rights, what role you see them playing and things like that.
Yeah, I mean, in your neurobiology, that sounds terrifying. Oh my God. Okay, that's great. Good for you. Glad that other people do that and not me. So thank you for doing that. Yeah, that's really interesting. I mean, especially that you had that discussion in like the context of bioethics, because for us, as if you think about it from like the human rights perspective, we can sort of say, at the 30,000 foot level, that everyone has the right to live life free of, blah, blah, blah. And we include repro in that. So right to health, right? And so then it's just there. And then whether or not governments as the, arbiter, or sort of like the rights holders, how much can they hold their government accountable to achieve that right, and blah, blah, blah. It's really interesting, too, because I come from a very conservative society, and that does not believe in reproductive rights as a concept, or that, that people's bodily autonomy is particularly important, right? So either from an LGBT perspective or from an abortion rights perspective. And so that's happening here in the US, right? Like, let's be very clear. There are tons of people who whether it's from a philanthropic side or, like doctors who provide services, across borders or things like that, that's happening. And it has always happened, right? That people have always sought clandestine, services, safe or not. And that could be abortion, but it could also be like various other things, right? Contraceptives, And so the question is like, at what point, I think for us especially as OSF, our goal is to make sure that civil society is empowered to hold their government accountable. Like, it's not up to us. While we would like governments to like be more liberalized on these issues, it is not up to us to like, tell governments what to do. Although we can, the point is to have individual civil society in that country to sort of speak up and be like, no, but really though, we need access to these services. But you're right. I think the responsibility, there's interesting debate to have there about the responsibility of folks to provide services in the context of which it is not available. And I think a good example of that is LGBT services for, so we call it key populations. So LGBTI people, sex workers, people who inject drugs in the context of HIV. So in many countries in which even PEPFAR works, but for example, the OSF works as well, governments are like, we don't have an HIV problem, or early in the epidemic, we don't have an HIV problem, and now we don't have gays. They don't exist. I don't know what you're talking about. We didn't just arrest 30 people at a hotel room for having a birthday party and being suspected of being gay. In Zambia, we didn't just sentence 2 men to 15 years in prison for a consensual relationship. What are you talking about? It is the responsibility of others to step in and make sure that those people have access to services, and I don't think that reproductive health is any different. And then at the same time, making sure that those populations, that civil society has the ability to organize, to speak up, to hold their governments accountable, to ask for more, to ask their governments to be better, and to, in many cases, too, to sway their neighbors. And it's also not just about the governments, but it's about changing hearts and minds too, right? As we know here in the U.S., that being so critical. So it's a really interesting question. I have no question about it in terms of the responsibility to provide access to those services, because I think it's a human right. But many other people have different views about the fact that it's not a right, and therefore you are not allowed to. There's a sovereignty question, for example, that many folks would like to argue, which I think is wrong. But it's a question of what you value over the sovereignty of a government to make decisions, and then the point at which the government is not providing the services that their people desire. Which is like a constant foreign policy question, right, that people have. To be clear, global health funding has, in a bipartisan way, members of Congress have pushed back on this administration's desires to cut global health funding. Like I told you, when the president puts out a budget, it doesn't really matter. And in this, the president over the last couple of years has put out a budget that really guts global health funding. And so I would say that in the past, like, no one would dare do that. And so to be totally fair, we have pushed back against that. But there has not been additional funding. Like we've been sort of stagnant. I would also say that I think that we've lost bipartisan support for global health funding because despite this policy being extended to global health, we didn't find people stepping up and saying, no, like you don't get to touch maternal and child health funding. You don't, and I personally don't think that one account is more important than the other, or that we should trade. But I kind of like would have hoped that that would happen. And I think that's a reflective of the time that there are less and less moderates on either side of, just moderate, like little m moderate in the political, and people have grown, more apart on the spectrum, and nothing does that like abortion. So, and so I think that is an unfortunate consequence. But, I think that I'm hopeful that we can continue to sort of support this funding in a kind of broad way, but it's just unfortunate because family planning and reproductive health funding, which again is just really critical. This is kind of like basic stuff we're talking about here, just like access to contraceptives and access to implants for women who are in an abusive relationship. I can't have pills be found. I mean, that kind of stuff. That stuff has been continued to be like under attack. And that's the part that used to be the most, it used to be super duper bipartisan, actually, family planning and reproductive health account from USAID. And you know this too. And it has just become so much more politicized because of abortion. And there's various other like policies that I haven't even mentioned that are under that are not just presidential politics, but are statute. So things that are in both the PEPFAR law and the Foreign Assistance Act, and that those create additional problems and restrictions for U.S. funding. And by the way, I could talk about this for like 3 hours because it's it was like my academic studies was on the impact of U.S. policies on reproductive health. But I think that the important thing here is that the impact on the ground is such that even if the policy isn't in place, there's this insane chilling effect. I mean, there's so many organizations that are scared, and maybe like two things happen, right? They'll either say, you know what, I'm just not gonna, like, even if the policy isn't in place, they'll say, you know what, I'm just not gonna change my policies because I don't understand the US political system. I don't know what the next president is gonna do. So I'm just gonna err on the side of not saying things or not referring people for services or not providing certain services. So that's scary. And then, or on the flip side, we have people who are perfectly qualified to provide services who say, you know what, we're not gonna deal with y'all. I'd rather work with DFID, the UK aid program, or I'd rather work with AusAid. I'd rather work with the Germans. And the point is that they're all great, but they aren't playing with the amount of money that we are. And so I think the international responsibility as to me, again, as stewards of taxpayer money should be that we use it in a way where it gets to the most people in the most need. But the flip side is that this administration and those colleagues feel very sincerely that what they are doing is making sure that they are being good stewards of the U.S. taxpayer money. And so that's the important thing to understand as well, is that the goal for both sides really is the same, which is like, we're going to make sure that U.S. taxpayer money is spent in the best way possible. Now, how you defend that, how you describe that is what's different. Yeah.
So two things I was thinking of. One, this is one, historically one of the most times we're most divided as a country. So while we're talking about global health, there are also topics outside of global health that are traditionally bipartisan that are not.
Yeah,
now.
exactly.
The
Title
other-
10 family planning.
Yes.
Yeah.
Even immigration.
Yeah, immigration.
And the other thing, just on being good stewards, an investment in family planning is one of the best ways to use money.
Right.
And so, which is logical that those same organizations that give maybe access to reproductive health services are also giving access to what, the comprehensive reproductive health services for abortion.
Right.
So taking away those, and these are some of these reports that I think will be really interesting for to review, is what is the financial, not even the human impact of it, but how are we therefore investing in other less cost-effective health interventions in order to achieve those goals?
Right.
And
So yeah,
that's really interesting.
Yeah, if you're not sold on the whole like health and human rights thing, like even just the money, like that it's $1 for every $1 spent on family planning, you get a $7 return on investment. So whether that's more, that could be like increased productivity from mothers. It could be increased community investment. I mean, there's all these other things that are rolled into that $7. So from a money standpoint, it makes sense. So then if that's, then what is it that is preventing you from seeing this as effective? It's sort of a moral or an ideological one, which makes it more difficult for folks to have a discussion, obviously, because it's a closely held, moral or ideological belief. You can email me I need to go home for bedtime, my baby, but you can call me.
It was more asking you you clearly love advocacy both in government and outside. I think one of the things that, and you alluded to this at the beginning, is that students look at, do you focus, partly it's what you care about, it's like, or what like moves you, or the skills you have. You're not a physician, I'm not, none of us are, right? But as you think about your impact, your personal impact through advocacy, like what are the things you focus on? Because the politics of the U.S. can be complicated, and victories can be distant or hard to measure, or victories can be the bad thing you prevented as opposed to the good thing that you advanced. And I guess maybe before you leave us, just a reflective for students who might be thinking about that as the advocacy space. How do you get your energy to know that those victories are making a difference?
Yeah, well, that can be hard, especially to Maeve's point, in these times when there's just divisiveness, and no matter what you work on or no matter what you're interested in, or what family you have around the Thanksgiving table, right? And so I think I get energy from the colleagues around me, frankly. I mean, so much of what we do is in coalition. It's not, I had 7 Hill meetings today that I did by myself, but I'm expressing the message of a coalition of civil society organizations that reflect and bring the voices of people globally, right? And I think that being able to be also a part of an organization that really centralizes the voices of those who don't generally have a voice, or can't just go walk into the Rayburn House office building and have a meeting. You know what I mean? And so that is tremendously valuable. I also just really enjoy working with people, and I'm a people person. And as you can tell, I like to talk, and so I enjoy human interactions with people. And to your point around like those little things, sometimes those little things are just getting one person to sort of be like, you know what? Yeah, you're right. Or, okay. And even Republican colleagues who I was able to be like, you know what? How can we get your boss to a place where he just doesn't say something harmful? Maybe he's not going to vote with us, maybe, or he's not going to sign on to our bill, or he's not going to sign that advocacy letter. But maybe we can get him to not go down on the floor next time and talk, against something. And it's things like that where, even the do no harm is important. And I get a lot of satisfaction from using those, and this goes back to my original point, those kind of interpersonal relationships that you have with people. And this sounds really cheesy, but at the end of the day, it is a lot about hearts and minds. And right now, being able to even just move a couple people to a more like empathetic, honest, compassionate place is really satisfying, where there is a tremendous need for empathy, for curiosity about other human beings rather than an assumption of a certain, of something. I know I'm getting a little nebulous, but it's late. That part is really exciting for me because I think that we need more curiosity and empathy in the world. And so a lot of what I do is, it's like super political. It's big P political, it's little p policy, but those people who are doing those things, either on the Hill or this administration, everybody has things that they care about. And it's like, how do you find those things, and how do we meet each other? I'm not saying I'm going to go sway, a vehemently like sort of anti-abortion person in this administration to not do what they're doing. But it's like, how can we at least have a conversation? And that's the part that I enjoy the most. And it is not always satisfying, but when it is, it's like, it feels really good. So yeah.
I love that. How do we have more empathy and be more curious? I think that's really great. So if everyone can thank Keifer Buckingham for coming. this evening.